Thank you, Chairperson, for giving me this opportunity. Self-monitoring of blood glucose for all diabetics.
Can somebody close that door because
is it really important or not?
Thank you.
So we shall be discussing it here in the manner of the debates. We all know that blood glucose monitoring has always been and it is an essential component of all current diabetes treatment regimens. So SMBG has been a simple blood glucose level measurement test carried out with the help of a glucometer. And we should have a goal of SMBG to collect detailed information about blood glucose levels at many points of the time to enable maintenance of a more constant glucose level by more precise regimens. We all know that many peaks and troughs in the management of the diabetes in the glycemic levels are injurious and harmful for the patient. So which of the following is on the higher risk? We just heard about the debate of HbA1c. These two patients, both are on the same HbA1c, but one is on the insulin pump using the insulin as part and another is using in basal bolus format. Here you can see that this is the level of blood glucose at different point of the time in a day. And mean of both of these readings is same, 123 milligram both the way. But if we really see the standard deviation from the mean, which is very much different. So who is on the better control? This person is on worse control as compared to him. This person may get macrovascular side effects. This person may get heart problem, cardiovascular risk as compared to this person, even if the HbA1c is the same. You must have been having so many patients in your practice. They may be saying to you, doctor, I am keeping my HbA1c 6.5, I am keeping my fasting and PP so controlled, but still I got the heart attack. You were saying that if you will keep your blood glucose level normal and at this level you will be away from all the complication. I have got the nephropathy. How could it be possible? This is the reason because of what we get it. This is the difference between the two HbA1c which are bad and which is the good. This yellow one is the bad performance of the HbA1c, although both are the same, but yellow one is having more peaks and troughs, yellow one is having more pits and fall. Because of what? This is bad HbA1c and this person is going to have more macrovascular as well as microvascular damage. Independent risk factor and better predictor of the cardiovascular mortality has been found to be a postprandial peaks. And here we are seeing in the yellow patients, the graph which is depicting the yellow one is showing more of the postprandial peaks. And minor hypoglycemia symptoms shall also occur to this patient who is maintaining with ups and downs, maybe excessive sweating, dizziness, and therefore it adversely impacts the quality of life. So this is the glycemic variability which has got the adverse effects on the glucose control as well as the complications of the diabetes, and we have got the only one thing by which we can avoid it, that is sustained glycemic control, and SMBG helps us in getting that sustained glycemic control. So these are the importance and benefits of the SMBG. We can see there are things like food, stress and illness which can cause blood glucose level to go high. At the same time, exercise, medicines and dietary restrictions can reduce it to down. But when it goes up by food, stress and illness, it leads to the higher HbA1c level as well as higher risk of the diabetic complications. So when we perform the SMBG, it benefits our patients by helping regularly monitoring blood glucose level, thereby empowering them to reach their target goals. One, creates awareness on blood glucose patterns and helps in better drug compliance. Improves glycemic control, which in turn helps to reduce complications, helps in identifying hypoglycemic and hyperglycemic blood glucose excursions. This you have seen in the last slide. These excursions are really responsible for adverse outcomes. So motivates this is the SMBG that motivates the patient to stick to dietary and exercise regimens for better glucose control. Hypoglycemic symptoms may not be recognized by young children or parents. So this is the SMBG which can give an idea about them. Helps in promoting better dialogue between patients and the prescribing doctor. Enhances patient education about diabetes and its control. It provides a valuable adjunct to HbA1c in achieving glycemic control. The better HbA1c control reduces the incidence of complication, reduce cost of the therapy in the long run, improved life expectancy, but this can only be done with the help of the SMBG. So this is a simple and effective, convenient technique at home, workstation, travel, and exercise. Accurate and immediate results are there, provides a real-time feedback. Results are displayed within a matter of seconds. So SMBG helps empowering our patient and healthcare professionals by both the ways, for the patient as well as healthcare professional. For the patient, it provides immediate detection of the hypoglycemia, so that whenever the patient is having any symptoms which may be of suggestive hypoglycemia, he can check it by using the SMBG. It can be used as a guide for timing and selection of therapies for the patient. This could be helpful for healthcare provider. Provides information to help with titration and provides feedback on lifestyle. As far as the healthcare professional is concerned, it gets an information on the fasting and postprandial as well as how they drive a patient's HbA1c. It helps with choosing appropriate therapies. It helps assessing impact of the therapy change. It confirms suspected hypoglycemia if the patient complains regarding that. So recommendations for the SMBG are there. The patient, those who are on the multiple shots of the injections of insulin, or they are on the insulin pump, they are suggested to go it for the 3 and 4 times a day. Patient, those who are maintaining above the target level and they are taking orals as well as once a day insulin, they are suggested to go with the twice a day, at least twice a day SMBG. Patients at target on oral agents or once a day insulin, once a day or one profile a week. One profile means a collection of pre and post meal glucose tests for a 7-day period once a day. Patient at target on orals and agent with insulin once a day are again advised to go with the same, and patients on non-pharmacological therapy are suggested to at least go with the one profile in a week. So SMBG lowers HbA1c level in diabetes patients using insulin. It is clear with this graph. An important thing is to notice here that fewer patients who used SMBG experienced fatal or non-fatal events. It is very much clear with this study. These people, those who have used SMBG, those who did not use the SMBG. The SMBG measurements can be used to predict severe hypoglycemic events. More than half of hypoglycemic events can be predicted with 3 to 5 SMBG measurements in a day. So these are the two comparisons between the 3 SMBG and 5 SMBG. Definitely the 5 SMBG have been found to be doing better performance as far as the hypoglycemia detection is concerned as compared to the 3 SMBG. This study detected 58% of the imminent severe hypoglycemic episodes in type 1 diabetes patient and 60% in type 2 diabetes patient when 3 SMBG readings were available 24 hours before an episode. So SMBG improves the psychological well-being of the diabetes patients. Glucometer has got few of the common features like all glucometers should be accurate, reliable, simple, short response in a time, small sample volume, large display, data storage capability. Some of the glucometer may have better features by hypoglycemia alarm, interface with computer software, telemedicine capability. Some of them are having the feedback option with injection device. Treatment recommendations algorithm are also being computerized with few of the glucometer, and of course they are designed to give less discomfort. So as a summary, SMBG an integral part of the diabetes management. SMBG has numerous benefits that ultimately results in better patient outcome. SMBG is recommended for patients treated with insulin and it's desirable for all patients with diabetes. It is simple and effective. So it is a key component of diabetes management. All persons with diabetes using insulin and or oral anti-diabetes drugs can benefit from SMBG use. It empowers patients to take greater responsibility for glycemic control, improving self-awareness, self-management and self-confidence. It should be available for all newly diagnosed people with type 2 diabetes as an integral part of the self-management education. Thank you very much.